All right, the live recording has, let's see, recording. Go ahead, member.
Okay, let's start with the main screen. Can we start with the main screen? Good afternoon, everyone. This is Assembly Member Clyde Vanel from the 33rd Assembly District, and welcome to our virtual job fair. Sorry we had technical difficulties earlier. We were trying to live stream this on Facebook, but we'll record it and post it up on Facebook afterwards. But we have a great virtual job fair here for you, and you're in for a treat. We want to make sure that, look, we understand it's a difficult time. We understand that, we're still dealing with this coronavirus pandemic. We're still dealing with one of the worst things that happened to our economy in the city, in the state, in the country, and in the world. But we also know that there are job opportunities. We also know that there are opportunities for you to be able to work and build a career and to get out there and to enter into the workforce. So we have some great employers that are here today, that'll talk to you, that'll tell you about opportunities that they have, and we're excited to do so. They'll tell you how you can get in touch with them, and you can ask questions if you're participating in this webinar. And if you're watching on Facebook, find out the information and contact them directly, and they'll tell you how to contact them. But we want to make sure that we get the jobs that are available, and we're excited about all the employers that are here today. We have with us, we have Health and Hospitals, we have the New York City Office of Mental Health, we have the Queens Center for Progress, we have Workforce One, we have YAI Seeking Beyond Disability, and we have QSAC, the Quality Services for the autism community. And they're going to talk, we have representatives from all these places that are going to talk to you about the opportunities that they provide. Today, I'd like to introduce the host from my office that helped put all this together. She's a superstar in our office. We're really excited about her, and she wants to, and she'll help introduce all the employers here. We have Miss Rachel Antoine. Rachel, take it away.
All right, thank you, Assemblymember Clyde Vanel. It's a pleasure to have all of you here, and today we are going to start with Michelle Jenkins from Queens Center for Progress. So she will go into much more details, and don't forget, if you do have any questions, please add it on the chat, and they'll be more than happy to answer all of your questions. Michelle, take it away.
Hi, everyone, and thank you so much for the introduction, and thank you for having us. This is a great venue. We are so happy to partner with our Assemblyman. Queens Centers for Progress, we are a major nonprofit organization that's been around for 70 years. As she said, my name is Michelle Jenkins, and I'm the Assistant Director of Human Resources, and I've been with them for 27 years. With that being said, what is Queens Centers all about? We provide comprehensive services for individuals with developmental disabilities. We have about 8 different programs for them. And right now I am recruiting for our residential program, which is located in Belrose, Queens, as well as in Jamaica. Before I get into the position, let me tell you what has kept me there for 27 years. Besides the wonderful work that we do in providing comprehensive services for our individuals, it's all about being person-centered. We look at the hopes and the dreams and the wishes, and we try to provide that for our adult population. And in return, we provide our staff with comprehensive benefits, ample vacation time, 18 vacation days, and if you're a senior like me, or I should say legend, it's 23 vacation days. We have tuition assistance for a bachelor's as well as a master's degree, because we believe in investing in our staff, and this is how you're able to grow into those other positions. Medical, dental, tax-deferred annuity, pension plan, life insurance, employee assistance program, We observe 12 legal holidays, and virtual health. We also provide that as well. So as you can see, we really invest in our staff and we take pride in providing comprehensive benefits. The employment opportunities that we have today is an RN Supervisor. That's a bachelor level person with an RN degree for about 2 to 3 years of experience in the hospital to oversee the day-to-day operations of our nursing services. We take care of 80 individuals in our group home. The next position is assistant supervisor. That would be working hands-on with our population, as well as in conjunction with the resident supervisor in providing the day-to-day services for individuals in their group home. So handling financial records, recreational planning, staff scheduling, someone with a BA degree and learning to get into the role of supervising. This would be an ideal position for them. And then the next position is day program assistant. That's working in a classroom environment. The hours are Monday through Friday, 8:30 to 3:30. You're helping the individuals in the classroom. We do have a few remote positions. Because of the pandemic, we've had to change our business model. So some of our individuals stay home and we provide them services via Zoom, this platform that we're on right now. So you have to be creative with that. And then we have some people that work directly in a classroom environment. We try to take them out to very local areas. You know, still with the pandemic is out there, we are practicing safety precautions. So we are very careful on where we take our individuals. And everyone, we make sure we provide ample personal protection equipment because your safety, as well as the individuals, is a priority to us. The other position is Hvac Technician. We're looking for someone who recently became certified. The position, we're flexible in hours, either 20 to 35 hours per week. Last but not least, the employment opportunity is direct support professional. These are our essential workers. They have been the heart and soul for Queens Centers for Progress. They have been running in when people have been running out. They help the individuals in their home and their goals, their wishes, their dreams, and to becoming independent or close to it. You would assist them in everyday, daily living goals, communication, interpersonal, money management skills. We do a lot of arts and craft projects, baking groups, singing groups. Again, the Zoom platform has been tremendous in providing those activities for our individuals in their home. We have campuses located in Jamaica Estates, as well as in Belrose, Queens, right off the Grand Central Parkway. We're close to the Nassau County border. In order to apply for these positions, you need a high school diploma, GED, and a New York State driver's license for close to 3 years. We provide ample training. First day on a job, you're buddied up with someone. So people who are interested in getting into the field of human services, this would be a great stepping stone for you. And for those that are in college, this is excellent because you have hands-on experience, as well as we can help you with the tuition because we give you 6 college credits at the CUNY rate. So that's a nice perk to have. Again, if you're interested in direct support, don't sleep on this position. The schedules are 4 p.m. to 12 midnight. We have early morning, I mean, you have to be early, 6 a.m. to 10 a.m., Monday through Friday. That position, you help the individuals get up, so you have to be a morning person. While you're drinking coffee, you have to give them coffee too. So it's one of those positions where you're in and out, helping them get up and start their day. For those people who are interested in trying it out, you feel you can't do it, but you'd be surprised. We have weekend spots just working on Saturday and Sunday, 8 a.m. to 4 p.m. or 4 p.m. to 12 midnight. It's great because the holidays are coming up. It's great supplemental. You can work every other weekend or a study weekend. We have some people who have been doing it now for 5 years. Every weekend they come and they help us with our individuals in providing comprehensive care for them. So that concludes what Queens Centers for Progress has at this time. I'm going to put my information in the chat area, or you can email me at mjenkins at queenscp.org. For the RN administrator, we have a dedicated hotline for them. The number is 646-341-1383. And I wish everyone the best of luck in their job search.
All right, thank you, Michelle. And I believe that Michelle will add all of the information on the chat, and feel free to reach out to our office as well. We'll provide you that information. And up next, we do have Adelina Hurston and Crystal Talbot from Health and Hospitals. They are the recruiter for talent acquisition. Crystal or Alina, please take it away.
So I wanted to share my screen. Am I able to do that?
Sure.
Okay. It says it's disabled.
I'll give you access right now.
Okay.
You are good to go.
Okay, perfect. Oh, still disabled.
1 second. Crystal, right?
Yes.
Co-host. I just allowed you to be co-host. You should be able to do it.
Okay, yes. Perfect.
It's working? Sorry.
Yes. Hi, everybody. My name is Crystal Talbot. I'm a recruiter with New York City Health and Hospitals Talent Acquisition Team, and presenting with me today is Adelina Hurston. She's the Associate Director of Human Resources and Talent Acquisition. So we'll go through, this is the agenda for today. We'll go through a brief overview of New York City Health and Hospitals. We'll go through our open vacancies in the Queens area. We'll go through our benefits. We'll go through how to apply. And I know at the very end, we'll be available for a Q&A if anyone has any questions. So New York City Health and Hospitals consists of 11 acute care hospitals, 11 acute care hospitals, 5 post-acute care / long-term care facilities, as well as 70 neighborhood clinics, Metro Plus, and community care. It is the mission of New York City Health and Hospitals to extend equally to all New Yorkers, regardless of their ability to pay. Comprehensive health services of the highest quality is an atmosphere of humane care, dignity, and respect. New York City Health and Hospitals serves as the healthcare safety net for all New Yorkers and cares for all without exceptions. And Adelina Hurston will actually present the rest of the slides.
Good afternoon, everyone. My name is Adelina Hurston, the Associate Director for New York City Health and Hospital. Thank you so much for joining us today. In our current locations at Queens Hospital and Elmhurst Hospital, which is located in Queens, we have the following positions available. At our Queens facilities, we have a peer counselor position available. The next position is a social worker at our Queens facility. We also have a clerical associate, hospital care investigator, staff nurse, a clerical associate, and associate medical records specialist at that facility. At our Elmhurst facility, we have a clerical associate position, nurse aide, behavioral health associate, staff nurse, part-time service aide, and clerical associate level 2. These are just some of the positions that we have available at our 2 facilities. And so if you are interested in working at our facility, you can definitely go to our website and you'll be able to see details about the job itself, the hours, and also the salary that's involved with and associated to the position itself. Some of our benefits that we have available, and it all depends on the position because we do have some positions that are union and some that are non-union, so it's all applicable depending on the position itself. We have health insurance that's available, vision benefits, dental benefits, prescription drug coverage, life insurance, annuity plans, transit benefits, and perks at work. In addition to that, we do have tuition reimbursement, again, depending on the position, as well as paid time off. So in order to apply to our website, please visit our website at www.nhhs.org. nychealthandhospitals.org/careers. Again, at this location, you'll be able to see all of our jobs that are available, not only at Queens at Elmhurst, which is located in Queens, New York, but you'll also be able to see our positions located in other parts of New York City. We do have facilities that are located in Queens, Brooklyn, Manhattan, the Bronx, and also Staten Island. So again, if you're looking for any type of position, we do have lots of positions available. And again, at our website, you'll be able to see the job details, location, as well as salary that's tied to that position. Thank you for joining us. And if you have any questions, please put it in the chat.
Thank you. And up next, we do have Theodore Wong from QSAC, Senior Recruiter and Intern Coordinator. Theodore, take it away.
Hi, thank you. Thank you, Queens Assembly Clyde Vanel, the 33rd District, for inviting us to the virtual job fair. My name is Ted Wong. I'm the Senior Recruiter and Intern Coordinator for QSAC, Quality Services for the Autism Community. To tell you a little about our organization, it was started by concerned parents that had children that were in the autism spectrum in the 1970s, where there was limited resources at the time to help autistic individuals. They started this organization to help build a community and provide services to develop their skills and independence. Now, QSAC is a New York City and Long Island-based nonprofit that supports children and adults with autism, together with their families in achieving greater independence, realizing their future potential, and contributing to communities in a meaningful way by offering person-centered services. QSAC pursues this mission through direct services that provide a supportive and individualized setting for children and adults with autism to improve their communication, socialization, academic, vocational, and functional skills. Our organization has now over 1,500 employees and we support over 2,500 individuals with our services. We're hiring for several positions in our organization. One position I must highlight, since we are always hiring and is the lifeblood of our organization, is direct support professionals. It is an entry-level position where we can train you to be a mentor to our individuals to foster independence in their everyday life skills. The population we serve on the moderate to severe side of the autism spectrum, so they do need a lot of remedial help. We need people that have a desire to help people and can guide them to learn and develop. The position is flexible, so it could be full-time or part-time and can have hours during the day, night, and weekend. This position supports our day rehabilitation centers and group residential homes across Queens, Manhattan, and Long Island. I also want to add that you would receive paid training, free certification for our first aid, CPR, AMAP, which is client medication distribution, and SKIP, which is behavior intervention techniques. We do have minimum requirements for most of these DSP positions that you must be able to drive, have at least a year of driving experience, and be over the age of 23 for car insurance purposes. Part of the position requires you to drive them sometimes to and from their site locations or to travel in public for inclusion activities like going to the mall or to the park. As it stands now, we have the greatest need for these positions in the Long Island area. We're also hiring for residential managers and assistant residential managers positions in our Queens and Nassau area. For this position, you would need supervisor experience and work history working with the OPWDD population in a residential setting. We're hiring registered nurses for our nursing department, and we have both full-time and part-time shifts available. These are considered field roles to support individuals in different locations throughout Queens, Nassau County, and Long Island. This role does require a New York State RN certification, and OPWDD experience is a plus. This position does require you to drive to make multiple site visits throughout the day. We have an administrative position in our nursing department located in Floral Park. It's a nursing data specialist position which focuses on updating our systems with our medical appointments. This person needs to be very detail oriented and able to multitask. We have a benefits assistant position in our HR department that needs to be filled. We're looking for people that have experience processing leave of absence, such as FMLA, TFL. If you have workers' comp experience, that's a plus as well too. Also in the HR department, we have a Human Resources Information Systems Analyst position. We need someone that has experience developing and managing ATS CRM systems, particularly with UltiPro. This person is highly detailed, analytical, and the primary contact for HR data and report creation. I do want to mention that we have fantastic benefits in our organization for full-time workers. You can pay as low as $1 per paycheck for medical and pay as low as $12 per paycheck for medical, dental, and vision. We have generous paid time off, 403B retirement and employee match, group life insurance, gym reimbursement, and pre-tax commuter benefits. Now, I just highlighted a few of our job positions. Please feel free to look at all of our jobs posted on our QSAC career page at qsac.com/careers. And you can also view our jobs on Indeed, which feature a quick apply method. After we review resumes and screen candidates, we'll invite you to apply directly through our online application portal as a next step in our process. And you can send resumes to jobs@qsac.com. Thank you.
Thank you, Ted. Please feel free to add all of the information on the chat. Thank you so much.
Yes, I will be adding it to the chapter.
Last but not least, we do have Jasmine DeFranco from CMB on disability. She is the Queens Junior Generalist Human Resources worker there. Thank you so much for joining us. Please feel free to take it away.
Hi everyone. Thank you so much for having us. So hi everyone, my name is Jasmine DeFranco and I'm the Human Resource Junior Generalist for Queens here at YI. So YI provides support services for people with intellectual and developmental disabilities, which can include autism, Down syndrome, and cerebral palsy. YI was founded in 1957 and was envisioned as an organization that would break the norm for people that were living with intellectual and developmental disabilities. Since that time, YI has a team of over 4,000 employees and supports over 20,000 people within downstate New York and northern New Jersey. YI is committed to seeing beyond disability. We empower people to make their own informed decisions about their lives and support people in choosing and realizing their own goals, increasing their independence and self-expression. We are currently hiring for direct support professionals, DSP for short, who will work directly with the people that we serve, creating new opportunities for living, loving, working, and learning. A DSP's goal is to help people achieve the fullest life possible by assisting them in the areas or activities that prevent them from being self-sufficient. Along with empowering the people we support, YI is known for our extensive staff training and promoting professional advancement within all of our programs. YI is a place to start and a place to stay. Applicants must have a high school diploma or a GED and a valid driver's license for all full-time and part-time positions. Certain skills that we look for in the ideal candidate are the ability to work in a team, interpersonal skills, effective communication skills, both basic written and verbal, and demonstrating accountability. No prior training is required to become a DSP at YI. All job-specific training will be conducted at YI offices or on-site at the individual programs. YI offers a robust benefits package for our full-time and part-time staff, including medical, dental, and vision, paid vacation, sick, and holiday time. Our newest holiday added this year was for 2021, was Juneteenth. We also have 403B plans, gym reimbursement, and tuition reimbursement. We have many programs within different areas of Queens, Brooklyn, Manhattan, and the Bronx, with various staffing needs, including weekends and overnights. If you're interested in our DSP positions, please apply on our website at yai.org. We are currently hiring through the pandemic as the DSP role is considered an essential worker role, and we're conducting interviews and virtual trainings in order to have people start in our programs as soon as possible. So just as everyone else did, I will be putting my information in the chat, and I hope to hear from you soon.
Thank you so much, Jasmine. So we do have some folks on the line and we are opening for questions. And all of the informations are now on the chat. If not, we'll take it away to the member. Let's just give everyone a minute.
First of all, thank you, everybody. Thank you for your great presentations. We'll let some people on the chat see if they want to ask questions, but I'm going to ask some questions. I'm going to ask some tough questions. Okay, everybody. So here's the first question for everyone. We're dealing with a pandemic, with a big, the greatest pandemic we've ever saw in our lifetimes. For your positions, where people are to show up in person, what kind of pandemic coronavirus protocols do you have in place at your organization, at your job, at your places? So anybody can take that first, but I'd like everybody to answer that question.
Hi, it's Lena from New York City Health and Hospital. At our facilities, since we do have staff, of course, at the hospitals that are taking care of our patients, they have all PPE, so personal protective equipment that's available, masks, gloves, hand sanitizer, and then depending on the location, if it's considered here in New York City, we have our red zones and our yellow zones, depending on the number of people that have been impacted. So for example, in our Queens area, they're in, I believe it's called a yellow zone. So they have also put into place where they have a certain number of people that can come in as far as visitation is concerned. So they've limited that to a certain number, and then also doing social distancing within the facilities. Crystal and I work at our corporate office. So with our staff, again, we have positions that are available throughout our facility, and we're at our corporate office. And so what we've done is that they've staggered as far as scheduling is concerned. So we're not in every day. Some of us work remotely. Some of us are in a couple days per week. And then also the social distancing, we're required to wear a mask as we come into the building. And then we also have PPE available, even though we're not directly working with patients. But we are trying to make sure that our patients are safe as well as our employees. So we've put a lot of things into place to make sure that everyone's good to go as far as being safe with the pandemic.
Yes, and Queens Centers for Progress has done the same thing in regards to people that are coming in. Every day our staff, they have their temperature taken before they're even allowed into the building. And then once they do get past that, then they have plenty of PPE. As far as our residents go, we are limiting visitation in regards to who can come in and who can actually take them out. And then we've also had to change our business model. Some offices, such as myself, is working remotely. We go in once a week, and other programs as well. They're staggering the amount of staff that are in the building. So we're definitely watching. Safety is a priority for us.
I would like to piggyback off of that because YI is very similar to everything that was already mentioned. So we are providing all PPE that is necessary to work with the people we support. If there happens to be any, positive cases that come up within the program, YI provides extra PPE just to make sure that there's abundance, that there's not anything, that we're not running out. Similar to what Michelle said, staff are getting their temperatures taken before they arrive to work, or as they arrive to work. We are also limiting the amount of people coming in and out of our programs. We are trying our best to support the people we serve within the programs and trying our best to limit going out within the community as best as we can. And we're following all OPWDD regulations to keep the people we support as well as our staff safe.
I'd like to actually piggyback on everyone's conversation as well too. Our company
you must have two things. You must have two things on because you have an echo or something like that.
Sorry, can you hear me?
Yeah, it still sounds like an echo going on.
Is that better?
I mean, for some reason there's an echo. You guys hear it? Yeah.
Is that better?
We hear you.
We can hear you. Go ahead. It's all right.
I'm sorry about that. I do apologize. So at our company, we do take your safety and definitely our most highest priority. Everyone actually has their temperature taken before they actually come into the building to make sure that they're not over 100 degrees. We also make sure that everyone's wearing a mask at all times, and we do practice social distancing within all the buildings. We do actually try to limit it to areas that we have at most 1 or 2 people per office. When it comes actually to our schools and our day habilitation centers, we actually are at 50% capacity to adhere to social distancing.
Wow, love it. I mean, it's interesting how great to hear that all the, you guys as employers are taking the pandemic very seriously and have the protocols and equipment and strategies in place to minimize the opportunity for this virus to spread. So thank you for that. That's very important. And we want to make sure that people know that the employers that we have here are very mindful about this pandemic and operating as safe as possible. So, are there any positions that are distance that include working from home or either full time or combination? Do you guys have any of those kinds of opportunities?
So YAI does not have those opportunities at the time. Our DSPs are considered essential workers that would be working directly with the people we support. So unfortunately, at this time, we do not have any remote opportunities.
Unfortunately, at our company, we have essential workers as well too. Everyone actually is required to come into the office as well for our corporate positions.
At New York City Health and Hospital, we have a combination. So the positions that I had posted on our presentation, those are positions that are actually sitting at the hospital. So they are required to be at the facility and work at the facility on a daily basis. However, on our website, we do have positions that work in different capacities. So for example, if there's someone that's interested in working in our IT department, those positions are working primarily remote. You may need to come into the office possibly 1 or 2 days a week. There are positions that are working also for like our HR department. Again, depending on the location of where the HR department is, if it's in our local hospitals, then you are working primarily every day in the facility. But if you're working at our corporate office, then those positions are working remotely. A couple days probably in the office, but then the rest is working remote. So it all depends on the position at New York City Health and Hospital.
Okay. Now, a lot of people ask these questions, and I usually ask these questions also, but experience. There are a lot of jobs, a lot of positions that are out there that ask for, and I know I've heard many of you mention about jobs with no experience or what have you, but a lot of people ask, do you need experience, or what kind of experience do they need for the job? What are you looking for? We heard what you guys were saying, but what are you looking for when you're looking to hire people? What are you looking for when you're looking to hire people for these different positions? What kind of experience are you looking for?
It's not about experience, it's about presentation. It's about your interpersonal, your communication skills. We're looking for someone who comes across as really wanting to care. And how do you portray that? Is, eye contact, telling us, yes, you're coming out of school and you don't have the experience, but you forget about all those other soft skills, about how you just make, someone smile for the day, about you generally care about someone, putting yourself out there. Communication is big because with our population, the developmental disability, you have to be really keen on what they're saying to you. Sometimes they're nonverbal. So are you really actively listening to them? They can nod, they can grunt. You have to be able to pick up on those skills. So again, it's about the person, how they come across. It's not so much your experience. The basic is having the high school diploma and GED, and the rest will be able to develop. But you have to have that patience and have a heart to want to work with people, because you're dealing with human beings, and sometimes they feel like they want to be bothered and sometimes they don't.
Yep, and I'm gonna piggyback off of Michelle again. So yes, very much so what she was saying. Why I know me specifically, and I know a lot of the people on my team, we look more for the soft skills than we do for the hard skills or for the experience. Here at YI, we're very big into thinking outside the box. So we're always looking for people that are willing to be creative, think outside the box, and people that just have an understanding for the rights of human beings in general. That's mostly what we look for.
Lena, any backgrounds that they need? Any experience?
So again, it depends on the position. So we do hire new people, new grads. So we hire new grads in a lot of our areas, so such as like our nursing area, our entry-level staff. So with those positions, just like Michelle and Jasmine said, we do look for those soft skills because the customer service is very important regardless of what level you're coming in. That can be from entry level up to management. As well as, you know, being dependable and being accountable for your work. Showing up is very important, especially when it comes to you taking care of the patients, because they rely on you to be able to get up out of their beds or, you know, just function on a daily basis. So that's very important. Outside of that, we do require for some of our positions that you do have experience. So like in our radiology department, we do require for you to have, I think, a minimum of 1 year of experience and also be licensed, as well as our nursing. Although we hire new grads, you have to be licensed. Social workers, you have to be licensed, but we do accept new grads. So it's a matter of having that education, but also the licensure that you have to sit for before you can actually apply and come into the organization. But, you know, I think the most important thing is like I said, being accountable, being dependable, being a team player, as well as just being respectful of your fellow colleagues as well as patients. I think it's important for us.
Theodore?
It's interesting that everybody that is here in the meeting is actually in the same industry working with developmental disabilities. So we're all looking for people that can be mentors to our individuals, to actually give them the tools to actually succeed, to be as independent as possible for their lives. And we need people that have big heart, have a lot of patience, and this is actually an entry-level position. So we will actually teach you the position to actually work with these individuals. And when it comes to our corporate positions, there are various different areas, and all of them do actually require an education that's probably geared towards those fields. So for the most part, a lot of them are looking for at least a bachelor's in those pertinent areas for those positions.
And you know, another piece I wanted to add is that as a role of a direct support, you have to be versatile. You're going to play 10 different or more than 10 different hats. My colleagues that are in the same industry, you know, I know you guys can relate. They're going to be a medical assistant, a chauffeur, a housekeeper. What else? What else is it, guys? Help me out here.
A cook.
A cook. What else? What else, Theodore? What else do they play? It's so many different hats.
So many different
Advocate, an extended family member, a therapist. What else do they play? It's like I counted, it was 10 different hats. IT sometime, because with the data collection, do you guys, is the Chrome booklet they have to use? And these are all the skills that we train them on. It's just you have to have that willingness to want to learn.
Absolutely agree.
So what's interesting is in the New York State Assembly, I serve as the chairperson for Internet and New Technologies. And one of the things that we are worried about is we're worried about the future for workforce, because a lot of software, robots, computers are taking jobs. Is that likely to happen for some of your positions in your field? Let's talk about that. Can a robot take the job that you're talking about?
No, you cannot replace a human and the human touch and the human emotion with a robot. That would absolutely never happen here. And I want to say, I can almost speak for Michelle and Theodore as well. It's just not something that will ever eliminate the roles that we're looking for.
This industry here is definitely job guaranteed. You will always have a job as in the field of human services, because as Jasmine said, you can't replace human beings. You know, a robot's gonna cook the food and serve it to them, chop it up, blend it. A robot's gonna take them into the room and shower them. It's like, oh, hold on, the robot didn't get the arm, didn't extend themselves. You know, come on now. This is a job. This is definitely is an industry for people who want job to be guaranteed a position, and you can work your way up. A lot of them started off as a direct support and now they're directors.
Yeah, I wholeheartedly agree. You can actually think even to our CEO, Lisa Viglia. She actually started as a part-time ASP worker, after-school worker, and 20 years later, she's actually the president, the CEO of the company.
And I can agree with that. So with our facilities, like Michelle was saying, you can't get a robot to take care of patients. They're not, it's not capable to have that, just that hug sometimes, or just a handshake or something like that, that personal touch. I'm sorry, unfortunately, a robot can't take care of that. I think for us, I think technology only makes it better, because then you're able to have the technology assist with documenting as far as like their medical records, so that those medical records can be shared. But as far as taking over, no, not in the facilities.
Interesting. You know, that's just something I just thought about, because we're very concerned about technology taking jobs, and look, it already has. I mean, it's crazy out there, but it's interesting. It's great to see that you guys are in a field that is safe from technology, relatively speaking, from technology taking over jobs. Now, it could help assist with the job, but taking over jobs, it's probably unlikely, or that's a long ways from now. So, all right, 2 more questions, and you guys are knocking these out the box. All right, so people ask a question. So there are people that have not been working for a while, and they have a big gap in their resume. Is that a big problem where they haven't worked for a while, or what have you? Let's, tell me.
Not at all, actually. The way that I look at it is each circumstance is totally different for everybody. There can be some people that actually took time off to start a family. Some people actually want to transition to a completely different field. So it's completely understandable as a recruiter that some people might have a break in their work history.
That's
I want to
true.
piggyback off of
We
that.
have to
Oh,
look at the
sorry.
circumstances. But really a gap that doesn't hinder them. You know, again, is how they sell themselves.
Yeah, I agree as well. That it's not a huge problem to have a gap in their resume, kind of like what Theodore said. They may start a family, or maybe they have to take care of a sick parent. So it's you never know this person's circumstances. So no, that's not a huge issue.
And that's the same thing for me as well. It's definitely not a huge issue at all.
I do have a question on how you guys are recruiting right now. So if the person just sent out the resume, do you conduct Zoom interview with them? How do you do this?
Okay, so at our company, there are 2 ways that you can actually get in contact with us. You can actually go to our website and go to our career section to look at all our open jobs. You can also go through Indeed. We have several positions actually that are listed there as well. There's a quick click apply, where you actually just can click just to apply to a lot of our positions. And this actually ciphers into our job bank, and we actually would review the candidates actually and contact them that are appropriate for the positions.
Yes, we're doing the same thing, various sources. I piggyback off of what Theodore said. We're doing a lot of that too on site. We're limited in regards to doing face-to-face now. Everything is via Zoom. So guys, get comfortable with it.
Yeah, definitely.
All right. Another question we had is, so there are people that have felonies on their records. Can folks that have served time, can they work at your company, at your facilities? Is that something that you guys do?
Absolutely. I think everybody knows that sometimes you make mistakes in your life, and the OPWDD field is one of those fields that it's very understanding and gives the opportunity to give second chances to people that know they made mistakes in the past and want to actually move forward in the future towards a goal and a career. And as long as actually you are in the position, you work the position, and are diligent, you will actually succeed in the position.
I would say that too. OPWDD, that's the governing body that we follow. They will dictate to us if we can or cannot hire someone based on the situation of their blemish that they have.
I agree. So just like Michelle said, depending on the circumstances, we're told if we can or cannot hire the individual. But yes, they, people can apply, and yes, they are considered for employment underneath New York City Health and Hospital.
Okay, one last question. Forgot about this. I keep thinking of it, and I want to ask the major questions that people would be asking or what have you. Do I have to wear a suit or a full dress or whatever, I don't know, a woman's suit to work every day?
No, and I don't suggest that you do. Part of a lot of the work that YI does is it's a lot of moving around. It's a lot of working very closely with people. It's about, being able to move comfortably, sometimes moving quickly. So I remember when I used to work in a residential program, usually the common, I guess, outfit was the jeans and t-shirt. Comfortable shoes, closed-toed shoes. The only thing that we really don't allow in terms of dress codes are hats, depending on the program, jewelry, and any shirts with any kind of, anything on them, any kind of certain designs or logos or certain things like that. But no, I don't recommend that anyone wears a suit. It's definitely not required, and it may be a little bit uncomfortable to work in this field.
It's like business casual. You have to be comfortable, but yet you also have to be mindful. You may be sent out with the individual. So please, no holes in the jeans, no ripped t-shirts, no slogans with all the craziness on it about licking this and all of that. So just be mindful of when you're going out in the field.
Sorry, one last question. Oh, Ted, Theodore, were you gonna say something?
Oh, I was just going to say that I agree. When it comes to our field workers, we have a very relaxed dress code. But when it comes actually to the corporate staff, we actually are business casual.
One last question. This is the last one for real. This has been an issue. Do you guys check as employers or as potential employers? We found that certain agencies and certain jobs and employers check people's social media, and some people have actually gotten fired or reprimanded for their personal social media. What say you?
I think it very much depends on the person's position. As I mentioned before, YI has over 4,000 staff. So it would be very, very difficult to go through every single person's social media. I mean, I don't know. I don't know what my other colleagues have here to say, but I know personally I don't go looking through people's social media. I have very, very, very other pressing things that have to be done. So that's not something that I personally do. I don't think anyone on my team does so either. I know people sometimes will look up my social media. I've had many people say, oh, I saw you on LinkedIn, or I saw your Facebook page. Which I guess is to be expected, but it's not something that I actively do, especially because and I'm sure Michelle and Theodore can agree, we do such high volume recruitment where it would just not be feasible.
Yeah, I actually agree with what you said. In regards to our our coworkers or our potential candidates actually in a company. It's not something we actually do on a regular basis, but it's understandable that when you have something out there in the public, it is out there forever. So as a tip for any future candidate, I'd be aware of putting actually anything out there on social media that you had concerns with.
Ditto. Just be mindful when you're out there. You never know. I know as HR, we don't do it, but I was not to say the managers don't. So
I wanted to piggyback on that as well. We don't look at social media besides LinkedIn. I know I look on LinkedIn, and with some of our positions, I know with my radiology positions, I'll go on their, we go on Facebook groups. So if, I'm on their Facebook groups, I don't actually look at their Facebooks, but, sometimes we recruit through Facebook as well. But I don't believe my colleagues look on the Facebook as well, or other social medias besides LinkedIn.
So first of all, thank you everyone for participating in this virtual job fair. Everyone, thank you for watching. We weren't on Facebook Live, but we are going to upload this on Facebook. Thank you for all the participants that are here also. Thank you for asking these questions that people are going to be asking questions about and figuring out. As far as your social media thing, I tell people, be mindful of what you want to make public, be mindful of your reputation in the real world, be mindful of your reputation online. So very important to be mindful of that. But we have employers here that are in an industry that is technological proof, right? So there are other positions that where folks may be concerned where technology may overtake the position or what have you, or close it down, and that's not the case here. And we have a whole host of different kinds of jobs and opportunities. We're going to share this on Facebook with the different links to how to find and how to apply to these jobs and where to get more information. I'd like to thank Jasmine for being here, Michelle, Theodore, Lena, and Crystal. Thank you for spending the hour with us. Rachel, thank you for putting this together. And we want to make sure this information is for you out there. We want you to get jobs and good positions and to work with great employers that that care about you as a person, care about your safety, and care about your growth and opportunities. Thank you for watching, everyone.
Thank you, guys. Bye.
Thank you so much, Assembly Clyde Vanel. Thank you.
Thank you again.